Welcome to The Prescription, the Tax Policy Center's biweekly webcast on fiscal policy for the COVID-19 economy. This is one of a series of conversations with state, local, and federal government officials, as well as leading economists and other experts. I'm your host, Howard Gleckman, a senior fellow at TPC and editor of our blog, TaxVox. Our guest today is William Spriggs, former Assistant Secretary of Labor and currently Chief Economist of the AFL-CIO, and Professor of Economics at Howard University in Washington, D.C. Before we begin, just a bit of housekeeping. This event was pre-recorded on June 24th, and it will be posted online at TPC's website. Also, if you'd like to talk about us on social media, please use the hashtag #LiveAtUrban. Professor Spriggs, you recently distributed an open letter entitled, "Is Now a Teachable Moment for Economists?" In it, you argue that economists too often assume that African Americans are different from white people. In your letter, you say that many economists believe people of color are inferior until proven otherwise. Explain to a lay audience what some of these faulty assumptions are and how they happen.
Well, I got Exhibit 1 just the other day. The Wall Street Journal posted an op-ed written by a very top Black economist at Harvard University, Roland Fryer, who has done extensive research on police misconduct. And I start with that because that is one of the crises that the nation is responding to, the nation finally coming to grips with what has been a long-standing complaint in the Black community. And if people will remember Dr. King's speech in 1963, they all love the "I have the dream" part because that's fluff. It's the therefore of the speech. They hate the whereas. But in his whereas part of the statement, whereas the US has done this and this and this and this and this, he lists police misconduct in his 1963 speech as one of the key problems facing the Black community. So that hasn't gone away. But in his op-ed, Roland Fryer says, look, a lot of people are misinterpreting my work on police misconduct. I just want to be clear about this. And then he cites this unbelievable statistic that in his data, Blacks are 350% more likely than whites to be the subject of some violent confrontation with police. And then, like a true economist, that can't all be police. It must be something the Black people are doing. I have to control for this. He says, I can get it down to, like 290%. But then he says, not an exact quote, but almost an exact quote, these are statistics, but economists cannot label racial disparities as racism. Now, if someone studied the history of policing in the United States, understood that in the early part of the 20th century, they were heavily infiltrated by the Ku Klux Klan, understood the way that police were trained when scientific policing took place at the beginning of the 20th century, that isolated Black people as the cause of crime, and the whole training of police from the beginning of the 20th century was the criminals are Black people. And you looked at the history of the dynamic of those police forces and you said, so you find a disparity and you don't think that's because of 100 and some years of it makes you scratch your head. And that's exactly what economists do. They abstract from the institutions, the history, and the forces that shape our society, and remove all agency from having created that history and those institutions, and then pretend that actors are then acting individually and therefore without any racial animus, because these individual actors don't have race and they don't live in a society where race matters, except that it does. And then we analyze the society in which race matters because of this historical and institutional set of structures. And then we want to act like, but none of that matters. and it is a scholarship which is harmful. Its roots lie in the genesis of modern economics itself. When you look at the economists who established the American Economic Association, the leadership, the progressive economists who did many good things, they're the ones who ended up promoting the types of policies that became the New Deal, and they were helpful with Roosevelt in busting trust. But they overtly believed that society should be racially organized, that white Anglo-Saxons were a superior race, and that one of the problems of the modern economy and of industrialization was that too many jobs were now available to the less desirable in society. And these immigrants from Italy and Poland and Ireland, and never mind those horrible Black people, now had a way to get jobs. And their quotes about race suicide, their view was that all of this was setting up race suicide, that whites would be outnumbered and overrun by these inferior races. And so that view of Black people as some natural occurring thing and not the legal construct of the United States permeates the way that economists going forward treated African Americans. They treat being Black as if obviously this is natural. These are Black people. This is not natural around the world. The color line is very different depending upon where you go. If you go to Brazil, Black and white are different things. If you look at South Africa, they have coloreds, and they have Blacks, and they have whites. I mean, the idea that race is this immutable thing and that it's self-evident is irresponsible. And the way that economists approach it is dangerous because we believe that rational actors would reward equal resources the same. So therefore, we must accept that disparities in unemployment and home ownership and income that are suffered by African Americans must be because African Americans are inferior on some dimension in some way. Not necessarily in a racist way, because the polite economists say, well, it's society, you know, racial segregation, bad schooling. It's not Black people's fault. It's all these actors who created residential segregation and poor schooling. And, you know, that stretches credulity right there, right? Because you're admitting there's some agency that created the segregated housing. There's some agency that created the poor schooling and the differences. So where did these non-discriminating people come from, given the agency that is shaping the society you're looking at? But let's excuse that for a moment. But this tendency to see inferiority in Black people is dangerous at this very moment. Because when asked, why do Blacks have this high death rate from coronavirus, the knee jerk is there's something wrong with Black people. And so people have been reporting this as comorbidity rates. It's because Black people have obesity, diabetes, and all of this. This is not in the data. It's not in the data. When the Centers for Disease Control looked at hospitalized patients in Georgia and studied people in the hospital for COVID, they found no racial disparities on any comorbidity. Blacks were not disproportionately obese, not disproportionately to have diabetes, to have lung conditions, asthma, or other of the comorbidity factors. And most importantly, Black people were not more likely to end up on ventilation, and they were not more likely to die. Black people died at being twice the number because they were twice the people who caught the disease, not because of comorbidity factors. And you say, well, why do you catch the disease? Who disproportionately are healthcare workers? the CDC looked at healthcare workers and they reported among healthcare workers that they could identify as healthcare workers and where they had racial information, 21% of healthcare workers that tested positive were Black. Now, Black people are 12% of the general population, but they are 21% of healthcare workers. So in other words, Blacks are not more likely to catch the disease. We're just more likely to be in the places where you catch it. Blacks are almost 2.5 times more likely to be bus drivers. They are almost 2.5 more times likely to be the frontline workers in elder care centers where we know the disease has been the most rampant. So when you look at that, you go, wait a minute, if white healthcare workers catch the disease at the same rate that Black healthcare workers catch it, and it's just that disproportionately Black people are healthcare workers, this is really a problem for workers. And the fact that a disproportionate share of white people get to stay home and telework is why we're saving white lives at the moment. But the way it gets presented, based on this idea that initially we must go to some Black inferiority thing, gives the impression that somehow or another white people are invincible to this disease or immune to this disease. And so we can open up and, just worry about, be nice to Black people because they're fat and obese, and be nice to old people, but that's not what's really happening, which is why you see the spikes throughout the country, because people have this in their minds that it's just those inferior people who will catch this disease. No, this disease hates human beings. Human beings. They hate the 99.9% of the genetic makeup that make us all human beings. That's what the coronavirus hates. That's what it attacks. No one is immune. And so it has real ramifications.
So give me a sense of the response you've gotten from the economics profession to the open letter.
I've been very fortunate. I have not gotten trolling, which is what I thought I was going to get, because Twitter is a very troll-oriented, snarky kind of place. And that's not what I experienced. Instead, I think I hit the note for a lot of people who are frustrated with not just race, but gender, the environment, and many ways in which economists have narrowed their vision and their models to marginal things. And because of big data, we're so much better at being able to identify a variable so we can talk about causality. And so we get so hung up on this program. It's a wonderful program. If you do this job training program, you can get wages up by 3%, as if that's going to address the huge and tremendous shrinkage in the labor share, or our narrow attempts at addressing gender inequality or cleaning up the environment. We have removed ourselves from the systemic questions by refusing to model systems. And that's something that economists actually have the skills and the ability to do. We just don't do it. And so I got a lot of positive feedback, because I think that's what resonated with a lot of people. It's like, yes, I agree with you, because they know there are these bigger questions economists are not answering or are refusing to answer. And I think this is a moment where we've begun to want to ask bigger questions, because we realize that there are systems problems, not just marginal problems.
So we talk a lot about how this is a moment in, for example, in policing. Is this a moment in economics? Do you get a sense that there's an inflection point here and that economists actually are serious about rethinking the way they approach race and gender and some of the other issues? Or is this just going to be more talk and then we're going to be back to where we were in a year?
Well, I think the jury is way out on that. First off, economists have to be more respectful. The other part of my letter was they don't read Black economists. They don't read what we write. And until there's a movement to take all scholarship seriously and to appreciate that there are different ways of approaching problems. I don't see it, and from many of the questions I get, people are sympathetic, but it is so amazing that Americans so accept the American definition of race that they can't get out of it. And so it's very hard for them to conceive of the notion that I made, that race is in fact an endogenous variable. It is, you have to have a group that satisfies the conditions, and over time we've changed who's in and who's out in the United States. At the initial hit of immigrants from Italy, as an example, the United States didn't want to give them whiteness, and they didn't. It's over time that the math doesn't work if you're going to make 80% of the people or 50% of the people non-white, unless you want to give up democracy. You can do the South African thing, but that means you have to give up democracy. We're not beyond that, as we can see in state after state after state, where we're trying to limit people's right to vote. So it's either you have to change racism, or you got to change democracy, or you have to do away with democracy. And unfortunately, we are seeing state after state after state try to figure out how can we eliminate voters.
Let me try to focus this a little bit on specific policy, specific economic policy. And I'd like to ask you, what makes a policy racist? Is it intent? Is it effect? You know, sometimes you think about policies like redlining or school segregation, and they seem inherently racist, I think, to almost anybody. But then you get issues like the minimum wage or TANF or preferential tax rates for capital gains or the mortgage interest deduction. Are they racist, and what makes them so?
Well, let's take minimum wage as an example. The initial decision about which workers would be protected was on the basis of race. Southerners refused to provide fair labor standards protection, or to include the occupations that were dominated by Blacks in the South for protection under the National Labor Relations Act, or to be included in the Social Security Act. That was purely along the lines of race. And since then, you can see repeatedly that those states that have a higher share of Black workers are the states that either have no state minimum wage, or only raise their minimum wage when the federal government raises the minimum wage. So there is true animus in the design of the minimum wage. And one of the most important studies to come out in the last 2 years was from a young scholar whose last name is Court. And what she was able to document was when Adam Clayton Powell became chair of the House Education and Labor Committee and expanded the Fair Labor Standards Act to finally include those occupations that had been left out, and also to raise the minimum wage to the highest level it had ever been raised in real terms. There was a huge disparate impact on Black-white wage gaps. They narrowed by almost 20% just from that one act. And so, yes, it had a racist intent. The history on that is clear. There was a clear intention to exclude African Americans, and there continues to be a clear intention on the part of too many states in the South to act with that same animus towards worker, broadly speaking. You can find it very hard to disentangle attempts to fight workers and to fight Blacks, because in the South, these things overlap. And And as a result, if I run a regression and I say, I want to predict bad outcomes for working people, I cannot tell the difference between a state with low union density and a state with high Black workers, a proportion of the population that are workers. That correlation is so high, you can't tell which one of these is the driver. Is it the lack of unions to give voice to workers and be part of the democratic process so that working people can have a say? Or is it an animus towards Blacks because they rely on labor income and to denigrate all labor in order to have a disparate impact on Black workers? You got to remember, as bad as it was for Black people to be excluded from Social Security at the beginning, and estimates, reasonable conservative estimates, mean this is like a $145 billion loss in wealth to African Americans for having been excluded. More white workers were affected because more white workers were agriculture and domestic workers than were Black workers. Yes, disproportionately this destroyed Black workers, but it destroyed the lives of millions of white people. And you can go throughout Appalachia today and see the remnants of that effect. So, you know, when people look at Appalachia and they wonder, why does Appalachia look like that? Because the same forces that didn't mind going after Black workers didn't mind sacrificing those people.
So we've talked a little bit about some of the poor policies and their effects on people of color. And you also talked a little bit about earlier in the conversation about these frontline workers. And I want to ask you in a more positive way, what are some government responses in the current COVID economy to the fragility of these frontline workers? And I'm thinking about grocery clerks, home health aides, transit workers, as you mentioned. What can government do in a positive way, maybe as part of the stimulus, part of economic relief, to support those workers?
Well, first, we need OSHA to actually issue guidelines for the safety of American workers. The AFL-CIO took OSHA to court over this. We had to sue them. Unfortunately, the court said, oh, it's okay. OSHA is doing its job, even though they have fined no one. They have one action. And yet we see in the news constantly Amazon workers striking because of safety conditions, the work that's going on among meat packers who are struggling to save their lives because of this indifference to safety. And the court said, oh, that's okay. OSHA's doing its job. It's not doing its job. So number one, OSHA needs to do its job, issue the regulations, and enforce the regulations. That's number one. Number two, in a normal situation like this, because the disease is so related to work and the inability to shelter in place and be able to have safe conditions, we really need to have a compensating differential paid to these workers, because in a normal economy, a job that is more risky gets a premium. And these workers are unable to do that. Some of the employers, in response to this risk, did offer premiums, but we're seeing them withdraw those premiums now. And Congress and the HEROES Act did step in to say, these workers are keeping our economy going. We have to reward them for the risk that they are taking on and the risk that they put their families under, because when they come home, they're coming home infected. And so many stories show up of not just that the worker got exposed, but then tragically, you see family members who are affected as well. In the CARES Act, for those who were unemployed, Congress took tremendous steps to correct a lot of what was wrong with the unemployment insurance system, which also has a deep racist history. Again, because of an attempt to accommodate the South. And when you look at the testimony given when unemployment insurance was to be put in effect, you saw the NAACP, the National Urban League, as well as the AFL-CIO say, do not give the unemployment system to the states. In the case of the NAACP and the Urban League, it was because they will discriminate. And sure enough, We look at Florida, it's almost impossible to get unemployment insurance in Florida. North Carolina has made it difficult. Other states have made it difficult out of this same animus. Fortunately, the CARES Act, went very heavily to address disparity in access. In 2018, sort of the last regular year we had in the labor market, if you were unemployed in the restaurant industry, fewer than 8% of those workers got unemployment insurance. And yet this is the big part of the industry that we shut down. 12.6 million workers faced unemployment. We lost over 8 million jobs in 1 month in that industry. If Congress had not stepped in with the CARES Act to repair the damage to the way in which those workers would have had access to unemployment insurance, the disparities would have been even bigger, but yet we still see disparities. Blacks are less likely to be receiving unemployment benefits because despite all that Congress did, it's still a state-based system, and those southern states still drive a disparity that's faced by Black workers.
Would you extend the plussed up federal unemployment benefits for an additional period of time, or given the flaws that you just described, is there a better way to get support, to get financial support to people right now?
No, the plus up is necessary, and I would extend it. I would extend it for several reasons. One, these workers likely face permanent job loss. It is very unlikely that the workers who have been the most affected are going to get back to their employer. And you have to think of this as sort of like a plant closure. While the unemployment rate for everybody else is around 10%, if you look at the most directly affected industries, the BLS estimates it's 34%. So from these workers' perspective, we just went through a plant closure. And we know that those workers will have lost income permanently. So part of the $600 you have to view as this is our way of figuring out how do we make up for the permanent loss in income that these workers suffered. Second, again, in a normal labor market, workers would be free to negotiate issues of exposure to dangerous work conditions. Workers need that leverage. And we already know from studies that NELP, the National Employment Law Project, has done, that Black workers particularly face strong pushback from their employers when they complain about safety conditions. And most workers have been intimidated against complaining about safety at work, but Black workers particularly have faced super animus over that issue. So we have these workers who are at risk. They don't have the tools. OSHA is not on their side. The $600 is necessary to level the playing field when it comes to bargaining about being in dangerous conditions. And then finally, you have to think about this from a fairness perspective. Look, as someone tweeted back to me, if $600 is a disincentive to work, that's because work doesn't pay. Don't look at the $600, look at what you're paying people. There's something wrong with a society that says, oh, $600 is too much to give you because then you wouldn't work. How about you think about why aren't you paying people at least $600 a week? That's where the conversation should be beginning.
Yeah, I think I saw that 80% of American workers make less than they're getting in unemployment right now with the additional federal benefit in their state benefits.
Yeah, I mean, that's an estimate. I'm not sure that I'm totally convinced of that because we don't have the best data on this, but that's a back of the envelope good guess.
Mm-hmm. So unemployment, we just have about a minute left, but unemployment insurance strikes me as a temporary solution. It's not really going to fix the problem. It's just going to help people until we can figure out how to fix the problem. What's the one step you would recommend that Congress takes to actually address this? Is it raising the minimum wage? Or is there some other way to do this?
Well, I mean, there are a whole lot of things that we're facing right now, all in one. So part of it is if you let workers get too far away from their industries, you're going to have a very hard time putting it back together. Mm-hmm. So unemployment insurance is not the best way, but unfortunately, unlike the rest of Europe, that's the path the United States took. I'm not being able to do this live on Thursday because in the morning I'm at OECD meetings on Zoom, where we're discussing exactly the comparison across OECD countries and how they approached it. The United States stands out as one of those who chose separate the workers from their firms. So as bad as unemployment insurance is, you got to think about how do you put it back together. It's not going to address the downturn we're in or the fact that we aren't generating new jobs for young people who are graduating now. So what we need to do is to have a jobs program. We need to be serious about fighting the virus. And there are hundreds of thousands of jobs that one could imagine easily. You got to have cleaning of public transit in order for us to get people back to work. You're going to have people who can trace people with the disease so we can isolate people who have the disease and contain the disease better. There are hundreds of thousands of jobs one can imagine that the federal government needs people to be doing right now in order to get the economy back to work.
Professor Spriggs, thank you so much. We could go on for another half an hour, but I'm afraid we're out of time. Thank you so much for taking the time and for your very interesting perspective on this. And thank you to the audience for listening in. We'll look for you again in a couple of weeks. Thank you very much.
Thank you.